So today let's discuss how we investigate for fertility. Now before we start, let us see what normally happens. In a lady with a regular 28 to 30 day cycles, an egg is released anytime between day 10 to day 20. Now this is counted taking day 1 as the first day of the menstrual period. So day 10 to day 20, what is known as ovulation happens. This is nothing but the release of a fertile egg from the ovary, and this goes into the tubes. In the tubes it waits for about 26 to 28 hours for the sperms. Once it is fertilized in the tube, it goes into the uterus and implants as the embryo. So in order to conceive, we need good ovaries producing eggs, we need patent fallopian tubes to receive the eggs and the sperm, and we need a nice uterus for the baby to come and implant. So whenever we are investigating a lady, we call these factors. We test the uterine factor, we test the tubal factor, and we test the ovarian factor. Now how do we go about testing these things? Now the ovaries are tested by hormones. So these are called FSH and LH tests, usually done on a second day of the menstrual cycle. There is also a new test called AMH, anti-Mullerian hormone. This test tells us the ovarian reserve, that is for what is her fertility potential. And the other important hormone tests that we do are, we do the complete blood picture to see if she is generally healthy, whether her hemoglobin is good and whether she has any anemia. We also test the thyroid function in all the ladies, and we do a blood sugar, because nowadays this thyroid disorders and diabetes are becoming more common. So that's about the blood tests. The next most important thing the doctor will do is a scan. Now a scan is a relatively painless investigation, and we do a scan to check the uterus, the patency of the tubes, that is whether the tubes are open or not, and whether the ovaries are releasing eggs, and if there are any cysts or any other problems. So this is how we check the entire reproductive organs and tell you that you can start off your pregnancy planning. Thank you.